Hi, my name is Ashley. I'll be your nurse today. I'm going to be inserting an IV. So first I'm going to do hand hygiene, either with hand sanitizer or with soap and water. I'm then going to check the name and date of birth to confirm I have the correct patient. I'm going to check the doctor's orders, and I'm going to assess for allergies to make sure they're not like allergic to latex or something. Next, I'm going to have the patient pump their fist like this and hold it in a dependent position to try to see what veins are looking good. So I'm going to try and see a vein that is bulging and also straight. Okay, so tap on it. It's looking like the pumping made it look good and we're all good to start. So I'm going to open up my kit and get everything prepped. So next, what I'm going to do is tie this 6 to 8 inches above where I'm going to be inserting the IV. And I'm going to leave it just partially tied so I can pull the string. Tap and see if there's bounce back. Next, going to get, oh, you know what, before I do that, actually, I am going to prime this tubing with, usually be IV fluid, but you could also use just the saline. So I would clean the ends first, and then I would prime it to make sure there's no bubbles all the way through, just like all the way through. And okay, now that that's done, I'm gonna get this and I'm gonna clean the vein I'm wanting to go in, which is right over here. You're gonna wanna do this for around 30 seconds to make sure it's fully clean. Then you're gonna want to wait for it to dry. While I do that, I'm just gonna go ahead and open this, leave it set up. Okay, so this is just gonna be a little poke, should be over pretty quickly. So I'm gonna go in at a 15-degree angle with the bevel up. And then once I see the flashback, I'm gonna kind of make it more straight. I'm gonna pull this taut so I can really get that vein. Once it's in there, gonna remove the needle. Usually I would hit that button, but we're in the lab and I'm not wasting needles, so that would go into the sharps. Then I'm gonna undo the tourniquet and put pressure right here. Make sure that stays clean. Next, I would clean both sides of this tubing with an alcohol prep pad and screw this on, holding that nice and straight. So I'm gonna unclamp this and use a flush, wipe that off again with alcohol, use a flush and make sure it's patent and not, make sure it's in the vein. Once that's good, I'm gonna clamp this back up. I'm gonna add a Tegaderm to make sure it sticks on there. I'd probably use this tape to tape this on. And then I'm gonna use this IV site sticker on here to put the needle gauge, the date that I inserted it, and my signature. And then after that, I would wash my hands and remove my gloves, obviously. So that's for insertion. And then for removal of the site, I would use a piece of gauze, which we don't seem to have, but I'm going to use this. This is gauze. I would use a piece of gauze, hold it there, remove the catheter, making sure I apply some pressure on this site, and then I would tape it down to really hold it there to stop the bleeding. And I would document where I did it, how the patient handled it, and the date, all of that.